back to HealthCare Consumerism Radio. This is Brent Macy and Ron Bachman, and would like to welcome Sarah Wilcox to the program. Sarah is with My Health and Money, and she is the president and CEO. Welcome, Sarah.
Hi, how are you?
Good, doing well today. Are you in Chicago?
I am. Freezing Chicago.
Oh, wow. Well, we welcome you to the program, and, why don't you tell our audience a little bit about My Health and Money, and then we'll dig a little deeper.
So we started My Health and Money as a way to support patients who are now responsible for more of the financial dollars for medical expenses, and realized that people were pretty unprepared in understanding what their choices were or how to make those decisions to save money. So this is an online support system where we guide people through a process of understanding how to navigate the healthcare system and how to make money-saving choices about their treatment so that medical care doesn't become such a huge financial burden.
Now, your background was, you come from the hospital space, is that correct? That was your original background.
Right. I started my career in healthcare about 25 years ago working in the administrative side of healthcare. At that time, patients weren't responsible for weren't responsible financially for their medical services. But what I saw over the years is that more and more of it was shifting. And then as I left hospital work and got involved with pharmaceuticals and insurance companies, and really was focused on the consumer healthcare marketplace, and realized that people were really struggling and didn't know how to maneuver. Because this was something that was new. And, it was heartbreaking many times in the hospitals, actually. We'd have people come in and say, look, my child needs an orphan drug. My insurance doesn't cover it. I'm going to have to go on Medicaid. What can I do? And at that time, there was very little that, advice that we could give them. But today, there are more choices. And more ways that people can now ferret out where do I get the care, and how do I make these choices so that I don't have to spend up to that high deductible level or have huge out-of-pocket expenses.
Sarah, this is Ron Bachman. Can you explain a little bit about how your service informs employees, patients on what their choices are, what the costs are? How do you do that? How does an employee using your service best access that information?
So our model is that not everybody's the same. And so the other piece of it is that we believe that there's a lot of emotional barriers to engagement in healthcare because people are really frightened when they get diagnosed with something or their family member does. It's a very anxiety-ridden experience. Right. So we've put a model together that allows someone to access our platform in any way that is the most comfortable. So, for instance, if you really want to talk to an expert because you really need that high touch, we have access to doctors, nurses, therapists, and patient billing experts that you can call, you can do video chats with. Most of these are 24/7 services. They're HIPAA-compliant services where you can ask questions. So maybe you weren't comfortable with your physician or didn't have time. You can go back and ask someone for help. The other piece is peers. We have a peer mentorship program, so it's more like the buddy system. So I just got diagnosed with diabetes. I have Aetna insurance or Blue Cross insurance, and I'm not really sure what to do. So we can pair you up with an experienced peer who's been through the process that understands how things work. If you're a data person and you want to understand what the costs are, we have cost transparency data on the site that shows you the hospital charge, it shows you the Medicare reimbursement rate, and gives you an estimate based on an algorithm that we've put together of what the average, commercial insurer will pay. And then what we do is we take you through education. Like, what do I do with this data? So pushing data to people isn't enough. We have to explain to people how you use it. So we take you through a 3-step process of, this is why these are the best to choose from because it's not about cheap care, right? It's about finding the best value. Second is making sure your insurance works, that you're in network and that these prices are close to what the insurer, they give you a range, but they won't tell you by facility. And then the third piece is, what do I do with this information from the provider perspective? So how do I talk to my doctor? How do I ask for a referral if it's a specialty situation? So we basically, everything we put on our site has an education component, so you know what to do with the information.
Mm-hmm. So what's your business model like? How do you get paid for those services? Does the individual pay for it as they're using it? Is this purchased by employers? What's the business model? We do sell directly to the business, either through the employer or through brokers or through other distributors like benefit administration or HSA administration companies, and that's a PEPM model, which is the standard model. We also have a B2C model, which we have a freemium, a free model where we provide certain levels of services such as, the discount cards, and we have a fundraising tool if you have huge expenses and need to reach out to family and friends. We also have a short-term loan program on the site if you end up in a disability situation and you need to pay your mortgage, or you just can't pay the medical bill. So that's free. You can do a one-day pass. So if you have a quick question, you just want to get in, get some quick cost data, maybe talk to a nurse about treatment options or talk to a physician. Or you can do a monthly, which really gives you the opportunity to access the peers and, really track your expenses by condition, by family member, and then compare it to other people on the site so you know whether or not you're high or low. Which gives you a way to think about the care that you're receiving and compared to other people who have similar conditions. So there's other things that you can do as a monthly member. So if I'm talking to a doctor online and trying to sort of almost get a second opinion, it sounds like, how does he get the information on what my medical condition is? Is there any transfer or submittal of my personal health record? Can I get my doctor to send them something? How does that work so that they've got the background on what my test might have been or what my condition is?
So there is a medical history upload and form that you would fill out. You also will need to pay, if you want a physician visit, there's an extra charge on top of what we charge for our monthly, because this is a different company that does this. And it is primary care doctors only. These are not specialists. Right. So if you needed a prescription refilled or you want to talk to a physician about a particular illness. The thing that we have to remember is that 1/4 of all physician visits are really information only. Right. And it's a lot of money that gets spent on having time with physicians. So, instead of the $150 question, there are other ways to get that information. And again, it can be peers. It can also be, physician assistants and nurse practitioners who have access to medical journals and medical information, who can take you through what other treatment options look like and then steer you to talk to your physician in the next visit. I think that what we believe is that if we're really going to get to cost containment, it's going to happen in the provider's office because that's where you're getting the treatment plan or you're getting the prescription. So the more you can do to go to that appointment prepared with the right questions and the right information, we believe that we can really drive down costs, but also increase compliance. Because, of course, what we're seeing now is that you go to that $150 appointment, or if it's a specialist, a $250, $300 appointment, you get a prescription, or you get a treatment, plan, say, for an image, an MRI or whatever. And because you have a high deductible plan, you don't do it. Right. Well, that's a complete waste of money and time for everyone. So what we can do is you can get on our site, for instance, and have it available. Bring your iPad, bring your phone into the doctor's office, look up the prices and have that conversation to say, Doc, I can't afford to come here and pay $3,000 for, an MRI. Do you mind if I go here? Right. It's 1/4 of the cost. And, it's that's the way we're going to get efficient in this system, is by people talking about costs and having that conversation at the same time you're having the care.
Are there state laws that create barriers to this kind of a service? Any sort of communication, prescription drugs, and the telemedicine kind of interactions that go on? Are there some state laws that are creating barriers for the type of service that you're offering?
It's interesting. South Carolina is the only state that doesn't allow telemedicine.
Okay.
There are some states that require, because we do the short-term mental health counseling,
right, that
require you to, there were about 10 of them, but those are changing too, that required you to have the first meeting, in person, and then you can do it on the phone, but those are also changing. The reason why we were really interested in mental health, which 90% of SSRIs are prescribed in this country.
Right.
It's a huge industry.
Right.
And unfortunately, a lot of those drugs are being prescribed by primary care doctors who don't follow patients as closely as, say, a psychiatrist would, and don't have all the information about interactions.
Right.
So for new types of drugs, we wanted people to have that resource to say, is this normal? Does this always happen with this drug, or should I be concerned about this, or should I, who do I talk to? That's
right.
Another one. People don't understand the difference between social workers, psychologists, psychiatrists, primary
right.
care doctors when it comes to mental health. So we felt that was important because of where the industry is really moving in terms of prescribing.
Well, I think the mental health issue is really a terrific one for you to focus in on because, when you have a panic attack at 2 o'clock in the morning, you still might be able to get online and get some help and
That's
support
right.
where you can't go off to your doctor's office until the next day or whatever, and you need help right then. Also, a lot of returning military with,
PTSDs.
That they need some help, and a lot of times they're not diagnosed when they're released it hits them, 3 months after they get back from Afghanistan. So I commend you for really focusing in on the mental health issues. It's really important, and just as a good example of how these services can work in a lot of different ways. It also, I've always said that, it's the moms that typically have the health care. They always have a little basket of stuff somewheres in the in the bathroom someplace in the
right.
shelf that's got, when the child wakes up at 3 o'clock in the morning with a cough or a cold or some sickness that they can deal with. You need to have a kind of service at times that, is not in the normal working hours. So there's a lot of really good opportunities out there for your kind of services. So I think you're doing a great job there.
Well, thank you. I think, too, there's a lot of unknowns about, the healthcare system is unnecessarily complex.
Yeah.
And so there's a lot of unknowns for people on both the care and the cost side. But, strangely enough, cost is a big driver for people to change the way that they, access health care. And so it's a huge opportunity for people to really think about what's best for them and best for their families. And the end result of that is that we'll hopefully have a more efficient system, and we'll have people will get the care that they actually need. Obviously a big example of this is, the emergency room and those types of things. But there's also huge opportunities in finding different levels of care for different needs, as you were saying. So, you don't need to run to the emergency room at 3 in the morning necessarily. Maybe you need to get on the phone first.
Well, thank you so much, Sarah, for joining us. And just let us know where our audience can find you, the web address.
Yes, it's www.myhealthandmoney.com.
Well, thank you so much, Sarah, and to all of our audience out there. Stay tuned for the next segment of HealthCare Consumerism Radio.
This is Ron Bachman, Chairman of the Editorial Advisory Board for the Institute for HealthCare Consumerism. The IHC is a collaborative community for innovative health and benefit management solutions. If you're a stakeholder involved in any part of the healthcare